Good morning, Anana. Thank you so much for joining me today. I'm really excited to hear more about the mindfulness and meditation workshop. I wanted to start off by just asking a little bit about yourself and your background.
Yeah, hi, good morning. Good to be here and talking about this. So I am a Brit, as you can probably hear. I started meditating when I was like 18, so that's about 30 years ago. And one of the first practices I learned was a mindfulness practice, as well as a loving kindness practice. So I've been doing it for that time in a predominantly Buddhist context. So I'm ordained into a Buddhist tradition. And then about 5 or 6 years ago, I trained in mindfulness-based stress reduction. So I trained in mindfulness for a more like secular, so less explicitly Buddhist. Although there are so many parallels and overlaps, it's sort of like a slight orientation, a difference in approach. Um, yeah. But so I've been teaching in New York City, for like the last 5 or so years, teaching MBSR in various contexts and teaching with a PSI as well for a similar amount of time, it feels like. I've run, I think, three now of the 8 week mindfulness-based stress reduction courses in collaboration with PSI and my co-lead, who'll be also co-leading this short course, Craig Sloan.
Awesome. Thank you so much for telling me a little bit about yourself. I'm super excited to learn more about this course. The first question that I have for you is, how can mindfulness and meditation practices support a clinician's spiritual development or integration of spirituality into clinical work?
It's a great question. I think that mindfulness, has Buddhist roots, as there's influences from Hinduism. We do some like mindful movement, which is pretty much yoga, very, very light. When we do the full MBSR course, and so I think the work that has been done in recent years and like in the last like 3 or 4 decades to bring mindfulness into a more secular context is has obviously been very beneficial, and it's made mindfulness much more accessible to a lot of people. And I think it can enhance someone's spiritual practice in a number of ways. I think so. Bearing in mind its traditional roots, I think someone with a spiritual orientation can get a lot from mindfulness practice because it's a contemplative practice. It's something that helps us to slow down, to let go of the things that are going on in our everyday lives, and sink down a bit deeper. We start with the body, kind of like feeling into the body and grounding into the body. So it's quite, a universal, thing to do, like, or kind of like we all have a body, and we're trying to reconnect with and feel into, yeah, what's happening in, I'll call it the body mind, our body mind complex. Um, and and I think that can lend itself to any type of spirituality. Of course, it's like in many spiritual traditions, Christian, Hindu, Islamic, there are contemplative traditions which I can't say I'm that well informed about, but I know there are parallels between what I would do as a Buddhist mindfulness practitioner and what somebody else might be doing in a different tradition. So I think this way of presenting mindfulness in a secular way can be supportive of anyone of any different spiritual from any spiritual background.
Thank you so much. Can you speak a little bit more about how mindfulness can reduce burnout, or support emotional resilience for mental health professionals?
Yeah, there's tons of research. I mean, it just keeps coming, and it's just this like burgeoning area of research, which is really, really great. But there are some like top line headings about the benefits of mindfulness. So, it helps improve mental health and well-being. It helps us to stay calm and be resilient. It helps with cognitive functioning. It helps with improved memory, better sleep. There are health benefits as well because it can help calm the nervous system, lower blood pressure. So there are all kinds of proven benefits. I mean, these are mainly studies that have been done over the longer term and at least over the doing the 8 week course of say, mindfulness-based stress reduction or something similar. And obviously, there's no like prescribed outcome. Every individual is different, but these are some of the general things that people are seeing, or the researchers are seeing through people who do mindfulness. So, yeah, in this way, being able, I think, just being able to stay centered through mindfulness, connected to ourselves. I think a lot of stress can come from being split and having like big thoughts, our nervous system being amped up, and like kind of a lot of like encroaching thoughts. And so what mindfulness can help do is just like I was saying before, connect us in with our body, connect us in with how we're feeling, and just allow that to come through. So if we are feeling tired and overwhelmed, allowing space for that. And if there is the option, finding a healthy response, rather than overriding, which we all do. Yeah, we all kind of can push ourselves to keep going, especially when there's so much need and we see people in stress and suffering. We want to keep giving. And that's wonderful. And it's really important to nourish ourselves. So I do think this is a very valuable tool. And I've seen, like many people that I've taught and others have taught who find these skills, sort of these tools really beneficial. Um, yeah, in doing just that, coming back to ourselves and our present experience, and just being able to, like when the thoughts are not clouding us so much, we're able to. I'm just looking out the window, and it's a beautiful sunny day, and it's been like really cloudy for the last few days. So it's like it's being able to take that in. So it's taking in the good stuff while not negating all the stress and the suffering that's out there and that we want to respond to and that hopefully we will respond to. But yeah, just allowing in the good stuff too so that we can stay nourished and resourced.
Yeah, I think that that practice of mindfulness and being able to be present is more important now than ever, especially for mental health clinicians. So I'm super excited for the content that your course is going to bring to these clinicians. My final question would be for clinicians who are new to mindfulness, what do you hope will be the biggest takeaway from this workshop for them?
I hope that clinicians will be able to take some tools away that help them to do this pausing, this stopping, and taking in what's around them, taking in both the internal landscape and the external landscape, perhaps in a more deliberate way. We're probably all doing this all the time, but in a bit more of a deliberate way. So, for example, if you're waiting in a line at the store or at the subway or something like that, it's yeah, it's finding a way to pause, and especially as well in relation to a client that's in front of you. So yeah, taking that time just to absorb and feel into um, perhaps like a bit deeper what's here. And I think in relation to what I was saying before, like that, like perhaps slightly deeper impulse can lead to something that's more, yeah, that's coming from, yeah, like a deeper, more in tune, connected place.
Awesome. Thank you so much. Do you have anything else that you'd like to share about the course or any final thoughts?
I'll be co-leading the course I mentioned with Craig Sloan, who's a wonderful guy. He's also a certified MBSR teacher and a clinician who's been practicing for years. I want to say decades in New York City. Um, so it's a wonderful partnership with him. It's great to collaborate with PSI as well. Um, and this will be a great introduction with yeah, so that clinicians can connect with their clients from this place of, yeah, perhaps feeling more connected with themselves.
Awesome. Well, thank you so much for taking some time today to chat with me a little bit about your upcoming course. I'm super excited for it, and I think it's going to be a great course for clinicians. So thank you.
Thanks, Cecilia. Yeah, bye.